Should you avoid gluten if you have thyroiditis? If you have thyroiditis, you might wonder if cutting out gluten could help your condition. It's a common question, especially since diet plays a big role in managing health. But the truth is, for most people with thyroiditis, there's no strong scientific evidence that avoiding gluten improves symptoms or thyroid function unless they also have celiac disease or gluten sensitivity. The main medical consensus is that gluten avoidance isn't routinely recommended for all thyroiditis patients. Let's break down what thyroiditis is. Hashimoto's thyroiditis is an autoimmune disorder where the immune system attacks the thyroid gland. This often leads to hypothyroidism, which means the thyroid doesn't produce enough hormones. In Hashimoto's, the body produces specific autoantibodies like antithyroid peroxidase and antithyroglobulin. Now, gluten is a protein found in wheat, barley, and rye. In people with celiac disease, which is another autoimmune disorder triggered by gluten, avoiding gluten is essential to prevent intestinal damage and systemic symptoms. Interestingly, celiac disease and Hashimoto's often occur together, so if someone has both, avoiding gluten is necessary. However, when it comes to people with Hashimoto's who do not have celiac disease or gluten sensitivity, research shows mixed results. Some small studies have suggested that eliminating gluten might slightly reduce thyroid autoantibodies or improve thyroid hormone levels, but these findings are inconsistent and not supported by large-scale evidence. A 2021 controlled trial found no significant change in symptoms or thyroid function in patients with Hashimoto's who followed a gluten-free diet compared to those who ate normally. Meta-analyses suggest that gluten exclusion might help some individuals with both Hashimoto's and gluten-related conditions, but overall, the evidence isn't strong enough to recommend gluten avoidance for everyone with thyroiditis. It's also important to consider potential risks. Going gluten-free can sometimes lead to nutritional deficiencies because many gluten-free products lack certain vitamins, minerals, and fiber. If not carefully managed, this could negatively impact overall health or thyroid health. Additionally, some crops grown in selenium-depleted soil may influence thyroid health, but that's a separate nutritional issue rather than a reason to avoid gluten. So, when should you consider avoiding gluten? If you have been diagnosed with celiac disease or gluten sensitivity, then gluten avoidance is necessary. If you experience gastrointestinal symptoms or other signs of gluten intolerance, it's wise to get tested for celiac disease. Some people report feeling better when they cut out gluten, but these are subjective experiences and should be discussed with healthcare providers. They can help determine if gluten is contributing to your symptoms and guide you on the best approach. In terms of diet, focusing on a balanced intake of nutrients is more beneficial. Eating foods rich in antioxidants, omega-3 fatty acids, selenium, and iodine can support thyroid health. Consulting with a healthcare professional or a registered dietitian can help you develop a personalized plan that meets your needs without unnecessary restrictions. In summary, unless you have celiac disease or gluten sensitivity diagnosed by a healthcare professional, there's no clear evidence that avoiding gluten will improve your thyroiditis. Making dietary changes should always be based on individual health conditions and professional advice. Remember, managing thyroid health involves a comprehensive approach that includes proper medical treatment, balanced nutrition, and personalized care. Always talk to your doctor or a registered dietitian before making significant dietary changes to ensure they're safe and appropriate for you.